Namaskar. Welcome to Ahara Arogya Adhyatma, the light of samskara. We can see light only when the eyesight is good. If the eyesight is not good, we cannot see the light, or neither can we see the light nor the world or the colors. And today we have a renowned ophthalmologist, Dr. Uday Patil, who has done more than 50,000 eye surgeries. And not only that, he has been in charge of the mobile eye clinic, which he has done more than 1,000 screening of the patients. And he is well aware of how the patients neglect their eyesight and how they don't come to the doctor. Last time he mentioned about the eye problems in the children. Today, he is going to talk about the eye problem in the middle age, and that too glaucoma. Many people have not heard about glaucoma because they always think blindness means cataract. Cataract means the eyesight. But today he is going to talk about the glaucoma. So welcome to our show. Namaskar.
Good morning, madam. Morning.
Yeah.
Morning.
So please tell us, what is this glaucoma? Because my own friend, she just came and she said her eyesight is disturbed and she's not able to see, and doctor have diagnosed as glaucoma as she was 60 years old. So what is that glaucoma? At what age it comes, and what exactly it happens inside the eye?
Yes, madam, let me start with the slogan, Sarve Indriyanam Nayanam Pradhanam. That is, the God has given us the 5 Indriyas, and among the one is eye, which I am going to talk as an ophthalmologist. As I have told you, in the last episode, we talked about the common eye disease in children. Today, we are going to talk about the common eye problems in middle age. So, one of the commonest problem we encounter in day-to-day practice is glaucoma. Glaucoma means, if the literal meaning is green sea. Green sea. Green sea called a glaucoma. Normally, the people reflex when you throw light, it gives a color is grayish black. Normally, but in glaucoma, when you see the people, the color has changed. So this is how the nomenclature came. When you, in absolute glaucoma, when you see, when the pressure has gone beyond 50, a long period, when you throw light, the people is no longer gives grayish reflex, they look very greenish blue. So that is how the word came, glaucoma. Glaucoma. Glaucoma means it's a Latin word.
Green sea. Okay.
Green sea. How that our forefathers have named. So glaucoma, normally, madam, as you know, we got some normal blood pressure. When you go to a physician, you record the blood pressure. But here, like that, eye has also one pressure to maintain counter. It's called intraocular pressure. It's how we measure from a machine called tonometer. Normally, we machine we measure BP apparatus like that. In when the pressure of the eyeball is raises above 20 millimeters of mercury, then it is called as glaucoma. This is measured by an instrument called tonometer, and many of the patients, they are not aware of it. There are 2 types of glaucoma: acute angle glaucoma and chronic simple open angle glaucoma. Acute angle means if the patient comes very early to you because the eye is red, he has got pain, so we can diagnose very fast. But whereas chronic simple glaucoma or open angle glaucoma is patient doesn't have any symptom. It is a slowly killing eye disease, and very common after the 40, and very common patients who are having diabetic for prolonged period. So after the age of 40, whenever patient comes to you for eye checkup, for a spectacle, it is the doctor who has to diagnose. Many patients are not aware of their diseases. The common symptom, what they tell is, doctor, I have to change my spectacles repeatedly, or I need more light to read, or some may get very mild headache. These are very common vague symptoms. Whereas when we examine the eye, the most important is the pupil reflex. There only we can diagnose. The pupil doesn't react sharply. There's some disturbance pupil reaction. Then we got doubt. Then we check the pressure with the tonometer. When the pressure goes above 20, then it is called as glaucoma. Then further tests we do like perimetry, the visual field damage. Because when the pressure is more, The
Okay.
pressure, what does, it presses on the optic nerve. And the
Okay.
optic nerve, as you know, it is a nervous tissue, and it is, the vasculature around optic nerve is blocked, and the optic
Okay.
nerve get damaged. Once the nerve damage is once damaged, it is a permanent damage. So he will have loss of vision, which is irreversible. So it is
Okay.
our duty to diagnose every patient who comes to you in OPD, whether he is having any increased ocular pressure by tonometry. It is the duty of the doctors who have to diagnose the glaucoma, and many
Okay.
patients are not aware of it. For
Okay.
glaucoma, madam.
Now, in fact, if a person has got a hypertension, we know 120 by 80 is normal. Anything 140, 90 above is more. So in glaucoma, how much is the normal eye pressure inside the eyes, and how much is, you call it as glaucoma? And what are the
Normal
grades
pressure
that they have?
Normal pressure is less than 20 millimeter mercury, 15 or
Okay.
17. Some doctors, they say above 18 also glaucoma, but
Oh,
about 20, the pressure is above 20, then we call it early glaucoma. Early glaucoma.
okay.
The
Okay.
pressure is more than 30, then the
Hmm.
advanced glaucoma.
Okay.
So normally the pressure should be less than 20 millimeter mercury. When the pressure
Okay.
rises, then it's called glaucoma. Then we have to treat it. First, we treat with topical anti-glaucoma drugs.
Okay.
With the topical anti-glaucoma drug, pressure is under control, and there is
Hmm.
not much loss of vision, and main importantly, the visual fields that you have to
Okay.
test. Fields are
Okay.
not damaged, then you can continue with the topical drugs. If there is one parameter is obstructed, either there is field loss is there, or pressure is not coming under control with the topical drugs, then you
Huh.
have to go for early anti-glaucoma surgery. It will
Okay.
prevent the loss.
So first you detect and then you put the local solution to decrease the pressure and to excrete more of it, and then you go for the surgery at the end. So when do you decide that this person requires the surgical management?
That is
And
three
what are the
parameters.
surgeries? What are the surgeries that you do?
Normally, if the patient comes very early, if the
Hmm.
pressure is not under control, if the mild, if there is a visual loss is there, then you have to go for surgery. Normally, we do laser aerodectomy. So
Okay.
facilitate the aqueous humor to come out from the outer chamber, and it goes through the angle of entry chamber. That is called
Okay.
ergon
Okay.
laser aerodectomy. It is done with a under topical anesthesia. It is OPD procedure. If it is
Hmm.
not under control, then we have to do anti-glaucoma filtration operation. It's called
Okay.
trabeculectomy. That is,
Okay.
it is being done if the pressure is not coming under control, and if there is a increasing loss of the visual fields, and the patient is vision is decreasing, then you did
Hmm.
not wait. You have to go for surgery.
Okay.
The three
Now,
parameters.
yeah, but many a times we won't know. There is not much of awareness among the public. Now, how will the patient suspect that they have got a glaucoma, or how to realize that there is something wrong is going on?
So every patient above 40, he should go for a eye checkup, like we do for
Okay,
your checkup and blood sugar. It is very common. Glaucoma is
okay,
very common, a middle age disease. Though we get some
okay,
pediatric patients also, but it is
mm,
very common in adults, especially
okay,
above 35 40. Whenever you
okay,
go to a ophthalmologist for your spectacle correction,
okay,
then ask him to please check your pressure also. Many patients
okay,
come to my OPD to check my BP like that. Usually, a doctor will make out this, by seeing the pupillary reflex. Then it is
okay,
mandatory to go for your pressure checkup also tonometry. Every patient above 40, if you do pressure, then
okay,
definitely when the pressure is more, then you have to treat very early. If it comes
okay,
very late, then it is a irreversible damage. Only we
okay,
can do, we can prevent further visual loss. It is every
okay,
patient your OPD after 40, it is
mm,
mandatory to check the intraocular pressure. A simple
okay,
tonometer, it takes hardly 5-10 minutes. We put some topical eye drops, and with
mm,
on the cornea, we put the tonometer, and it will
okay,
use the pressure. Pressure is check
okay.
up, then the pressure is normal, forget. Pressure is more than 20, 25, then go for other tests like field tests and vision.
Mm.
Most important is vision. Visual loss is there irrespective of your topical treatment, then you do not wait for surgery.
Okay, okay. In the vision, which part of the vision is lost in glaucoma?
First, it starts from central fields, then
Okay.
gradually goes to periphery. Central fields, many patients are not aware of it. It is our
Yeah.
duty to do perimetry and see the any
Ah,
spectrum on the
okay.
retina. Patients are not, when the visual loss is advanced, then
Okay.
we not do anything. It is mandatory to do a simple perimetric test. Central visual
Okay.
fields around the macula, that is first affected. Then gradually it spreads to periphery. So
Okay.
that is you to check up
Okay.
early
And
glaucoma
now,
treatment.
out of curiosity, I'm asking, sir, now more of children are using mobile for a long time. The students and everybody is addicted to the mobile, and to their screen time has also increased. Does that have any effect on the eyesight and then the glaucoma? Is early setting of glaucoma can occur because of the misuse or disuse of the eyes?
It can occur. It can occur. As I have told you, if you
Hmm.
see the mobile phone for prolonged period, the first thing is your tear film will be affected. Cornea becomes
Okay.
dry. Then
Okay.
patient has to more pressure. He has to accommodate to see the things.
Okay.
When we start accommodation, then the angle of entry chamber, there are some changes. He may develop some
Ah,
glaucoma. When the
okay.
people start conflicting and you have to accommodate, then you may have still problem in the angle jungle. It is rare,
Hmm.
but
Hmm.
if you see mobile for hours together, it
Hmm.
will what you call it induce glaucoma
Hmm.
very early in the later time. That is
Early,
very
early.
mobile should be avoided in the children. Okay, for
Okay.
everything should go for mobile for not hours together and for continuous period. Watch mobile, then definitely will have eye problem. First
Okay.
of all,
Okay.
corneal tear film, then you other diseases like the accommodative
Okay.
reflexes, all these things.
Okay. So that means straining the eyes unnecessarily, watching the television or the mobile for a long time continuously should be avoided. And if they have a mild headache, they must come and get their eyesight checked. Even if the eyesight is good, if there is as you said, that more light is required to read and write, then they have to come. And as you said, that we check up the blood pressure because it's a silent killer. But here, glaucoma is the silent eyesight or a blinder. So,
Yes,
hence, to avoid the loss of sight, people have to come to the ophthalmologist. And when the cataract is there, it is seen and their vision is deteriorated, they come. But when glaucoma is there in earlier stages, they don't realize. So, you have told that they have to come to the ophthalmologist, get their eyesight checked, and get their pressure in the intraocular pressure to be checked. And thank you very much for your kind and very lucid and very nice description of glaucoma, sir. Thank you very much.